The COVID-19 pandemic limited our ability to gain face-to-face input for research projects from public contributors. In addition, the lockdown negatively affected the mental health of both PPI staff and public members. This poster describes how the Wessex Public Involvement Network, an umbrella organization which includes the Southampton Clinical Research Facility, established the Researcher Coffee Mornings in the spring of 2020 and how it has evolved to its current form. Establishment of Research Coffee Mornings. In April 2020, while the UK was under the first COVID lockdown, the PPI team contacted public contributors via a mailing list, inviting them to half-hour coffee mornings 3 times a week. Multiple online platforms were trialed to host these before settling on Zoom because it was easy to use and preferred by contributors and staff. The Research Coffee Mornings were initially formed to provide a space for socializing, providing COVID-19 research updates, and pastoral support. However, in the summer of 2020, with input from the public members, the coffee morning formats were changed by focusing more on inviting health and social care researchers and stakeholders such as city council members and charity staff to talk about their work. The frequency of the coffee mornings were trimmed to once a week with a once-a-month social sessions. As of the 6th of October 2021, there have been 107 coffee mornings, with 63 of them being researcher-led. The list of upcoming coffee mornings is updated on the Wessex PIN website, and video recordings of talks by researchers are uploaded on our YouTube channel so that public members who missed the session can watch. At the end of each researcher-led coffee morning, a link to an electronic feedback form is emailed to attendees so that they're able to enumerate things they liked about the session and areas for improvement. The collated feedback would then be grouped into themes, and a public member, researcher, and PPI staff wrote reflective pieces to tease out the impact of the coffee morning from their perspective. Based on the feedback collected and reflective pieces written, the impact of the coffee mornings varied among 3 stakeholder groups: public members, researchers, and PPI staff. For public members, the coffee morning served as an avenue for intellectual stimulation, social interaction, and the chance to meet health and social care researchers. Because of the frequency of the sessions, they provided, and I quote, a consistent regular structure and much needed routine to the week at a time when normal patterns of life were prevented. Quantitatively, the coffee mornings were rated 4.72 out of 5 by the public members in terms of quality of information conveyed, helpfulness of topics discussed, and opportunities to ask questions and express points of view. For researchers, the coffee morning were a platform to engage with the public about the upcoming and ongoing research projects, a chance to get actionable feedback, especially during the grant application process, which had knock-on effects such as funding, and a way to invite public members to join their PPI panels. Finally, it was also an opportunity for academics to develop public-facing skills that could benefit their work. For PPI staff, the sessions helped in gaining virtual facilitation skills, as coffee mornings had to be done completely online. It helped in creatively applying the UK standards of public involvement in a previously unexplored context. The regularity of the coffee mornings and the social sessions helped the team build deep personal relationships with public members, which led to more bespoke PPI opportunities shared with them because the team understood public members' individual research interests and motivations. The coffee mornings have had an impact beyond the 3 aforementioned stakeholder groups. For example, the meetings themselves could be considered engagement as interactions between researchers and contributors are often a one-way exchange. However, lots of these sessions led to PPI work, thereby serving as a springboard for engagement to involvement. The increasing number of public contributors attending the meetings created a pool of knowledge and expertise ready to be shared with researchers who seek support from the public involvement team. Finally, other institutions such as the Aging and Dementia Research Center at Bournemouth University have adopted our model in terms of patient engagement. If you want to know more about our coffee mornings, kindly get in touch with us at publicinvolvement@uhs.nhs.uk or click on the call to action button, and you'll be directed to our website where you'll find links to our electronic flyer, our YouTube channel where the research talks are uploaded, and a list of our upcoming coffee morning sessions. Thank you.